Pneumonia is a lung infection that can be from a community-acquired pneumonia or a ventilator-associated pneumonia or aspiration. In this video, I'm going to discuss how pneumonia affects the lungs, so stay tuned. Okay, so before we get into it, if we haven't met before, my name is Christina. Welcome to my channel. I help nursing students through educational content, strategies, and practical tips to help gain career confidence. Let's get started. Within your lungs, you have 3 lobes on the right side and 2 lobes on the left side. You have your windpipe, referred to as your trachea. This helps carry oxygen-rich air to your lungs that expand into branches of your bronchi that settle into these tiny little grape-like air sacs known as alveoli. Now let's expand on one of those alveoli. This is where gas exchange occurs, where carbon dioxide is blown out, which is the waste your body does not need. And below that is a network of capillaries and blood vessels that help with oxygen exchange. So in the setting of pneumonia, within the alveoli, this is where the infection occurs. The infected fluid will leak out and travel into the blood vessels surrounded by the alveoli, which will block exhalation of carbon dioxide and hence will cause signs and symptoms of pneumonia, such as chest muscle pain from excessive coughing, fever. Sometimes they may have dyspnea because of that poor gas exchange, and they'll feel lousy and so uncomfortable with lying flat that they'll be seen sitting upright in a forward position called a tripod position. Be sure to check out my video on crackles, link above. The crackle sensation sounds from the air exchange from the alveolar sacs, or you may also hear wheezing on auscultation. This is from inflammation of those narrowed airways. So this video covered how pneumonia affects the lungs. I have more videos that align with the respiratory system. You can find them on the end card, and I'll put some links in the description below. So that's it for today. Be sure to subscribe and hit that notification bell, and I'll see you, my friend, in the next one. Take care.